most of the units are sort of a dial, and some of them are digital. Uh, the mercury, again, you should not be using any of them. Okay, so I doubt anybody have any. Anybody have one? Nobody have them laying around, right? Okay. Otherwise, turn them in. Right? We didn't ban assault rifle yet, but we banned those. So that's the reason why, if you have your own, bring your own, so you don't have to share earwax. We have these so that you guys can practice together if you want with your partner, so you can hear the same thing. Well, of course, we'll be using this during your practical exam, so I can hear. So you can't just make up a number, right? Because I will be listening. You heard from the video that normally there's a sort of a diaphragm side, and then you have the bell, based on the high pitch sound and sort of low pitch. And you can turn around, you can see there's a little hole there. You can see if you turn this way, now this is blocked off. So another way to check, of course, is to listen, and you can hear. Like if I tap or rub on this, I don't hear as much, but this is very loud. Okay, so this is another way to check to make sure you're not turning the wrong side. Otherwise, you wonder why you don't hear anything. But you do need this to hear. So what are you going to be looking for when you're checking pressure?
Heart rate.
What's there to listen? What are you listening to? Okay. You're listening to the blood going through the artery based on what you just heard. That look, no. But you normally don't hear it, right? Right now, if you just put it on the forearm, you just find where that brachial artery usually is around here, right on the medial side of your, same place where you palpate your brachial artery.
Mm-hmm.
So if you're right on it and you listen, most of the time, sometimes you can hear it, but most of the time you don't, okay? So what's the purpose of this? All right, the purpose of this, of course, is to create constriction. So as you pump, this thing squeeze, to the point where eventually we'll get to a point where totally it will just clamp down on the artery. Okay. So when you clamp it down, of course, then you're not going to hear anything because there's no more blood flow. Right? So you shut that off temporarily. So by squeezing, then you see it up to a certain pressure. This is the millimeter of mercury. When it gets to a certain pressure, that's when this shuts down. So the way you start, very often people always ask, right, how do I know how high do I bring it up? Because if you never met that person, you don't know what their pressure is, okay? So the way to do that, of course, is to first set this up, put it on. You have your hands on the radio pulse. Right? When this is not constricted, the pulse should be down here, right? Should be circulating. So as you squeeze, this getting tighter, eventually got to the point that shuts it down. This should be gone, okay? So that's one way you can check. Then if you see that by the time you feel, oh, okay, this is gone, and you'll get that number, they say maybe bring it up to another 10 or so, just to be sure. All right, and that's it. Some of you probably been to doctors in places that it goes up to like 200. They don't care who it is. They don't care what your pressure is. Your blood pressure could be 90 over 60. They pump it all the way to 200. They just don't want to bother to check. That's really what it is, because technically you really shouldn't do that. Because by squeezing so hard, you're temporarily collapsing and you're just providing way too much pressure, and then when you start releasing it, because it takes so long, the pressure builds up. That first boom, that pressure is not the actual pressure of that person, because you've generated so much pressure here, It's like you're restricting the dam and you're building up more water. When you open the dam, boom, it's gonna have a huge amount coming, flooding down, okay? So that's another reason why you really don't wanna, over extend yourself that way, okay? So that's one way to do it. But personally also, I actually like the other way, is I start listening on the way up. Because when it's down here, I hear nothing. And then eventually, as I continue to go, if I go up slowly, I'm gonna start hearing. Because there's more and more pressure building up, that artery is starting to get a little more pressure, a little more squeeze. I start to hear sound on my way up. And eventually, we'll get to a point where all of a sudden the sound is gone. That also telling me, well, then that means now it's effectively I've collapsed the whole thing. So when I don't hear anything, I could probably check to say, okay, yeah, no more pulse here. So that's another way for me to tell how high should I go. Right, so let's say at 120, I don't hear any more, a little more than 120, and by 130 I still don't hear anything, I'm not gonna keep going. There's no point in keep going. So at most, maybe it's like 120-ish, I'm probably bringing it to maybe 140, that's it. And then I'm gonna stop. So what do? First, the hardest thing for every student, I guarantee you, is playing with this gadget. This is the valve, okay? If you take this, you will see, like a regular knob, you're turning clockwise, you tighten it. And just hold it here, you will see. Right, it goes right up. Right now, this is, of course, not much pressure. So this is tight. Right, so right here. So what happened? Yeah, why don't you hold this for me? Just hold it for me. So you have a certain pressure there. Right, so it goes up. You guys able to see? Alright. Coming around, you all can see. Alright, so it goes up, and you don't have to go super fast, you bring it up. Let's say right about here, say, oh, I don't hear anything anymore. So that's it, I'm not gonna go a whole lot further. And depends on how tightly closed. A lot of time, like this one actually leaks a little. So you can see, well, also maybe he's letting it go. If you hold it in place, this is shut down. So this is tight. So if that's too fast, right? I lost all the airs, like, wait, I missed it, I didn't hear it. So that's too fast, right? So this is tight, this is release. So you're gonna have to learn, remember that, and then when you open, you're gonna have to like, just enough to let it go down. So hold it again. Right. So let's see, bring it up to here. And then you're gonna learn to, hopefully in time you can do it even with one hand. Just release the valve enough. Okay, and now you start saying, oh, I start hearing, boom, 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 right? And then that was 100, I start hearing it as it going. Let's say now it started diminishing, and let's say by 60, oh, it's gone, I don't hear anything. And then, okay, if I still don't hear anything, okay, now I'm gonna let go all the way. So I just registered as 100 over 60. The systolic and the diastolic. So the real key is learning how to, you decide which hand works best for you. First you learn controlling, you understand this is tightening and this is releasing. In time you're probably gonna need to learn how to do this in one hand, because you do need the other hand to handle this, or to do whatever it is that you need to do. So it's not gonna be, in the beginning maybe you'll do this, but in time you have to figure it out, either hand, just to know which direction to turn. Now you could hold it down this way, whichever your hand feels comfortable to you. That's what you're gonna need to practice. And the other part is just learning how to release very gently. So as per. So what you really don't wanna see is it going up fast and going up high number and then just, always laugh. I look at it like the nurses take my pressure. Literally, it's like, come on, there's no way you know my pressure. They go, shh, shh. Wow. It's so fast, like just slip right through. Because if it dropped down so quickly, the first time you hear it, maybe it really was 120, but because it dropped so fast, by the time that person hears it, the first dope, it's already dropped past. And same way here. Like the last one that you heard, maybe it was at 70, but because it dropped so fast, it just swept right through 70 and down to 60. And you never hear it again because you already went past it. So that maybe it wasn't 70, maybe it was really 60. So if you go down too fast, you will miss it. That number is not going to be accurate. Okay? So controlling this is really what you need to do. Now the cup, as you can see, they tell you in a certain size that you really should have it. If it's too big or too small, that also affects the accuracy because it's not covering the artery, it didn't generate enough pressure, or so all of these. So this is pretty much designed in kind of a standard size. They do come in various different sizes. So if you have a pediatric setting or in bariatric setting, you probably will need a different cup size for individual. Most of the time, we do it on, the bicep, the brachial. You can track pressure on distal lower extremity as well. Has anybody done it or you seen it?
Yeah, I've seen it on the calf.
Right.
The
Yeah.
forearm.
So there's one thing they call the ABI. You know the ABI? Ankle brachial index. So actually they're comparing the upper extremity pressure versus lower extremity pressure to see the gradient difference. Normally there shouldn't be a big difference, okay, maybe slight, but if the gradient difference is too much, that usually shows that the pressure of the lower extremity is lower, and if that number, the difference is greater than a certain range, is considered diagnosis as arterial insufficiency for the lower extremity. And those are the people that, again, you're running risk of having arterial ulcers or circulation problems because they're just not getting the blood down to the lower extremity as well as it should be. Okay? So what do you think? Questions so far? Does that all make sense?
Mm-hmm.
Anybody want to try? Anybody want your pressure checked?